All right, good morning, Dr. Ara Deuk with the Deuk Spine Institute. I have one of my patients here who is no stranger to back surgery. You had a really big back surgery done years ago, right?
Yes.
When was that done?
That was done about a year and a half ago.
The big back surgery?
About a year and a half, 2 years ago.
About 2 years ago. And after that surgery, you still had back pain below your surgery, right?
Yes.
And that was a fusion you had done before?
Yes.
Okay. Where was that done?
That was done near the middle of my back.
But where did you have it done? What state was it done, or what location?
Oh, it was in, actually I had two. I had one in Huntsville, Alabama, and one in Daytona.
Daytona, okay. So you had two back surgeries, and then after those two big back surgeries, and his incision is that long on his back at least, but below that incision, he was having horrible pain until 6 weeks ago. And what happened 6 weeks ago?
6 weeks ago, the pain was extraordinary. I could barely move my left leg. I was trying to get out of bed each morning, and it was you're waking up thinking, okay, I've got to deal with this pain. But it felt good waking up one morning. I realized I was expecting the pain, and it wasn't any pain. So I got out of bed and stood up, and I said, normally this is the point where I go looking for some type of painkiller or somebody to kill the pain. So I was referred over to the Spinal Institute, and they, after one short surgery, the pain is gone. So I can honestly admit that I think about it, I respect it to happen, but it really doesn't. That's the funny thing about it, because when you're used to something for so long, it just is in your memory. But the pain, I'm pain-free as of now.
That's awesome. You had the Deuk laser disc repair.
Yes.
On the left side, because he had left leg pain, and we cured his back pain, and we cured his left leg pain.
Yes, definitely.
And that was 6 weeks ago we did your surgery.
Yes.
I'm happy for you.
Oh, I'm very happy.
Yeah, you look like a new man than when you came in.
Yeah.
I almost don't recognize you because your face looks so good. You look much happier, less stress.
Oh yeah, a lot less. When you get rid of that pain, it feels great to get up in the morning, the next morning.
Well, congratulations.
Yeah, thank you, doctor.
You are welcome, sir.
I really appreciate that.
You're welcome. Have a good day.
Mm-hmm.